Welcome and thank you for joining us for today's webinar, Revitalizing Health at the Core, Nurturing Healing, Nutrient Repletion, and Nitric Oxide for Optimal Blood Flow, brought to you by Natural Medicine Journal and sponsored by Berkeley Life. We have a few housekeeping notes to go over before we get started. If you need any technical assistance, we first recommend refreshing your browser. If you continue to have technical questions or issues using the On24 platform, please use the Q&A box and we will respond as soon as we can. There will be no call-in number for today's session. To connect, you need to have access to either a computer, tablet, or cell phone audio. Everyone has been muted. So that you don't miss any shared content or an opportunity to share valued feedback with us, we recommend you enable pop-ups within your browser. If you happen to get disconnected, you can log on again using the instructions provided in your webinar confirmation email. If you continue to have trouble, please email info@naturalmedicinejournal.com and we will respond as soon as we can. For your convenience, everything in the webinar console is fully customizable, so you can move things around, resize the window, and even turn on captions for this event. At the bottom of your console, you will also find a resources box where you can download the slides as well as any additional content for today's presentation. And again, you can ask questions at any time by submitting it through the Q&A box. We'll leave some time at the end of the session to answer as many questions as time allows. And finally, this webinar will be recorded and you'll receive a thank you email with the on-demand materials within 2 business days. And with all of that out of the way, I'd like to introduce our speaker for today. We'll hear from Dr. Nawaz Habib, founder and functional health consultant at Health Upgraded. Dr. Habib is the author of Activate Your Vagus Nerve and host of the Health Upgrade podcast. He graduated as class valedictorian from the Canadian Memorial Chiropractic College in 2010 and went on to practice traditional chiropractic for years until he utilized the power of functional medicine to transform his own health. Dr. Habib is the founder of Health Upgraded, an online functional health consulting clinic supporting optimal health by elevating the awareness and function of the vagus nerve. At this time, I'd like to welcome our speaker and hand the webinar off to Dr. Habib.
Hello, everybody. It is an absolute honor and pleasure to be here with you today. Thank you for taking time out of your busy schedules to be here with us today. Today, I want to dig into the concept of revitalizing health at the core. And this comes down to nurturing healing, nutrient repletion, and nitric oxide for optimal blood flow. Very quickly, want to share our liability disclaimer. The information presented here is provided for educational purposes only and is not intended to diagnose, treat, or cure any specific disease, nor a replacement for supervised healthcare. The author of this presentation is not liable for any use or misuse of the information provided within or herein. So I'm going to dig into understanding how we on the front lines, these are all of our primary healthcare practitioners, are sitting here at the front lines of an epidemic in chronic disease. We see very clearly that 6 in 10 Americans have a chronic disease. 4 in 10 Americans have 2 or more chronic diseases. Approximately 70 million Americans are living with some sort of gastrointestinal disorder. And the leading drivers of chronic disease and disability in North America are heart disease, cancer, diabetes, chronic kidney disease, stroke, chronic lung disease, Alzheimer's, depression. I don't need to dig into this with you guys. You are seeing this on the front lines. And so what we need to do is provide some really important tools to help us understand why they're happening in the first place. What are these root causes, these root driving mechanisms that are leading to these chronic diseases? And one of the most important and chronically overlooked and ignored drivers of all chronic disease is, without a doubt, suboptimal blood flow. Healthy blood flow is a foundational pillar of wellness and healing, and it matters for various reasons. There's a lot going on here, so let's dig into it. It allows for oxygen and nutrients to get to where they need to go throughout the body. It drives the elimination of toxins. It supports healthy immune function, allowing white blood cells to go where they need to go. helps every chemical and mechanical aspect of the brain and body function properly, and impaired blood flow leads to a myriad of symptoms and chronic disease states. With regards to chronic disease, every single chronic disease is characterized by some form of decreased blood flow to the affected organ or tissue. And this then clearly comes to the fact that if you can restore that blood flow and perfusion to each of those organs and to each of those tissues and cells, you can correct most, if not all, chronic diseases. So how do we restore blood flow and perfusion to these specific organs and tissues? This is where we enter the miracle molecule, which is nitric oxide. So nitric oxide is key to healthy blood flow. It is absolutely, without a doubt, required for red blood cell delivery of oxygen to the lungs, from the lungs, to the tissues, as well as the export of carbon dioxide from those tissues out of the body via the lungs. It regulates vascular tone. It helps control mitochondrial oxygen consumption. It transmits signals between neurons in its neurotransmitter form as well. And it very importantly suppresses pathogens when utilized by macrophages and other immune cells. But how does our body actually boost these nitric oxide levels? And I want to dig into the science here a little bit with all of you. The answer to this is there's various mechanisms by which the vagus nerve is heavily involved in the signaling to improve nitric oxide levels within the body. As we can see here, we have the afferent vagus nerve, which is sending signals up to the brain. 80% of the signals on the vagus nerve are actually afferent from the body to the brain. This includes jugular and nodose ganglia, as well as carotid baroreceptors sending information up. Those carotid baroreceptors, a few of those specific neurons, are actually vagus nerve neurons, and they make their way up to the nucleus tractus solitarius in the brainstem. And there's processing involved above within the central nervous system. And then we have the dorsal motor nucleus of vagus that then extends the efferent vagus nerve pathways down to the rest of the body. In the gut, we have the myenteric ganglia and then the enteric vagus nerve that comes down to the gut to signal with acetylcholine to the macrophages to help reduce inflammation. But how do we get these signals to the blood vessels in particular? And this comes down to the celiac or superior mesenteric ganglia that then actually has the vagus nerve innervating the splenic ganglia or the celiac ganglia and allowing for the splenic nerve to then signal to these cells right here called CHAT T cells, CHAT plus T cells. These are CD4 plus T cells that are present in the spleen that then go out to the rest of the body via the bloodstream. And these CHAT plus T cells are the answer to how do we get the acetylcholine out to then signal to the rest of the body via the blood vessels to produce nitric oxide. These CHAT cells are the key to all of it. CHAT plus T cells, CD4 plus T cells that contain the CHAT enzyme. CHAT stands for cholinergic, my goodness, this name has completely come out of my mind here. Cholinacetyltransferase is the name of this enzyme. So it's the enzyme that's required to bring acetylcholine together from its sources, acetyl-CoA and choline. Now these CHAT T cells make their way out through the bloodstream, and as they go through the lumen of the bloodstream in the intravascular space, these CD4 plus CHAT T cells have the CHAT enzyme bringing together acetyl-CoA and choline, which then produces acetylcholine. Acetylcholine is released into the intravascular space and then attaches to the M3 muscarinic receptor on the endothelial cells. So these are the first lining, the tunica intima of the blood vessels, the endothelial cells that have these M3 receptors. These M3 receptors, when activated, go down a cascade to activate the eNOS enzyme. eNOS stands for endothelial nitric oxide synthase. And this eNOS enzyme converts L-arginine into nitric oxide in the endothelial cell. That nitric oxide is then passed into the smooth muscle cell in the tunica media of the blood vessels. And this is where the nitric oxide enters to turn on the cGMP enzyme, allowing the smooth muscle to relax. And this relaxation of the vascular smooth muscle then allows for the blood vessel to dilate. We get vasodilation. And this occurs only when we have healthy endothelium. And this healthy endothelium requires the production or the presence of that eNOS enzyme. eNOS needs to be functional and effective in order to allow for the L-arginine to be converted to citrulline and nitric oxide. Okay, so eNOS is the key here. If we don't have an effective functioning eNOS, then we're not going to get nitric oxide production effectively. This is where we have issues like oxidative stress driving eNOS into not functioning. And we'll talk about what that means. But endothelial dysfunction then results in much more vasoconstriction. Vasoconstriction reduces the amount of space that the blood has for blood to actually make its way to the endpoints of where the blood vessels want the blood to go to those cells. And so we have less nutrients being able to get to their endpoints. What this results in when we have oxidative stress and eNOS dysfunction or eNOS inhibition, it leads to nitric oxide scavenging. They're constantly looking for sources of nitric oxide, resulting in oxidative stress ongoing and oxidation of hemoglobin, which is a whole nother reason for why these chronic diseases are happening in the first place. So we don't want to be in a vasoconstricted state. We want to be much more capable of being in a vasodilated state. This is really important to understand because when we don't have that state effective and we have endothelial dysfunction, when eNOS becomes uncoupled due to oxidative stress and various other stressors and inflammatory signals, what this leads to is pathogenesis of vascular diseases. The presence of uncoupled eNOS has been proven in patients with diabetes, hypertension, coronary artery disease, congestive heart failure. And eNOS uncoupling was also demonstrated in animal experimental models of hypertension, diabetes, ischemia, reperfusion injury, and aging, and confirmed in vitro in human and animal endothelial cell cultures. So this is really important to understand that this eNOS that we're so reliant on to have function in order to get these endothelial cells functioning, in order to get the vasodilation occurring, if it becomes dysfunctional or dysregulated, endothelial cells will not be able to produce nitric oxide effectively, and those vascular smooth muscles will not be able to relax. That lack of relaxation results in vasoconstriction and all of these major conditions that we've heard about. And the link to this, what's really interesting, is that these CD4 plus T cells, these CD4 plus lymphocytes expressing that choline acetyltransferase enzyme, when in some wonderful testing that was done, they had these chat knockout mice where essentially they knocked out this chat gene, the production of the choline acetyltransferase. And what occurred was a decrease in cardiac output, meaning the heart was working harder, stroke volume went down, fractional shortening, ejection fraction went down, and most importantly, the end systolic volume went up significantly, actually. This is the chart right over here where end systolic volume went up. What we're seeing here is when we have a chat knockout, people have higher blood pressure. This means that if we're not getting good amounts of acetylcholine through the body, that means we're not able to produce enough nitric oxide, and that is resulting in vasoconstriction and resulting in a lack of blood flow. This is the challenge that we have to fight against. This is where we have to really stand up, because what we're seeing now very clearly is that nitric oxide is implicated in all chronic disease. Anything from cardiovascular to cancer therapies to COVID-19, very specifically for cerebrovascular diseases, respiratory system issues, Alzheimer's, insulin transport, very importantly, in liver diseases, and lastly, in chronic kidney disease. It's been implicated in many, many different conditions. In fact, nearly all of the conditions that are listed here have some nitric oxide implication within it. Well, there are two ways to actually obtain nitric oxide. We talked about this one right here. We've just recently spoken about the L-arginine pathway, where L-arginine with oxygen go through the nitric oxide synthase enzyme. And this nitric oxide synthase enzyme in the blood vessels is called eNOS, endothelial NOS, that we just spoke about. And that's where the production of nitric oxide is going to come up. That's going to have its biological effects. But what happens when eNOS is dysfunctional or not working? That means we are not getting that nitric oxide production through that pathway. We have to use a different pathway, and that's where we get the nitrate pathway. The nitrate pathway is our bypass system, and this is a system that we're utilizing at Berkeley Life to help get this blood flow back to optimal and have those positive biological effects to support the health of our patients. So why does this even matter? Well, we know that endothelial production of nitric oxide declines just generally as we age. We know that these numbers decline more rapidly in men than in women, but by the time we reach age 55, 60, those numbers are very low. About 10% of the nitric oxide that we were used to producing in our teens is down in that very, very low number. And that is a major result or a major cause of chronic disease with aging. The percentages of nitric oxide production that's present doesn't allow for recovery or the flexibility and resilience of the blood vessels. We have 80% of the nitric oxide, we already have thickening of the arteries. If we have 50% only, we have inflammation and plaque buildup occurring. At 35%, we have stiffening of the walls of the endothelium and calcium buildup. And at just 15% nitric oxide, this results in rupture of blood vessels, and why we have so many cardiovascular diseases even happening at this time. So what are some of the things that we can do? Right off the bat, let's get that dietary nitrate system working. If we want to go back very briefly to this slide where we want to look at that nitrate pathway, the way to activate that nitrate pathway is, excuse me, I'm flipping here. The nitrate pathway, we need to go through the oral microbiome and utilize the nitrate, nitrite, nitric oxide pathway. Okay, so from a dietary perspective, let's start getting in some foods that contain these dietary nitrates. The highest containing foods: arugula, bok choy, celery, lettuce, spinach, and Swiss chard. Other very good ones: Chinese cabbage, endive, fennel, mustard leaf, radish, beetroot, broccoli, cabbage, carrots, green beans, leeks, turnips, cauliflower, cucumber, potato, asparagus, Brussels sprouts, garlic, onion, peas, and tomatoes are all good sources of dietary nitrates. And this is really important to understand, that there is actually very significant changes and concentrations of the nitrates based just on geography. In Raleigh, North Carolina, broccoli is sitting at 555, versus in Chicago, it's at 271. Cabbage in LA is at 800, and New York is at 193. There's geographic changes that are major here. In LA, celery has 2651. In New York, 88. In Dallas, lettuce has 1370. In Chicago, it's 207. And spinach in Dallas is 4923. In New York, only 564. This is pretty significant to tell us that based on our geography, we may actually have these major challenges in getting these nutrients, these nitrates, to our clients and into their bodies and into their blood vessels. And the clinical implications of this we've talked about already: cardiovascular function, gastric function, sexual function and hormone production, stem cell treatments, hyperbarics, neuropathy and diabetes, oral health, something that we'll talk a little bit about because it's very important in this particular stage, cognitive function, neurogenesis, aesthetics, anti-aging, exercise performance and recovery. This is an area that I've personally noticed a major change in my recovery process since I've been utilizing these dietary nitrates, and functional nutrition overall. All right, so when we support optimal nitric oxide levels, it allows for everything else to work better. It helps us shift into a state where recovery is more likely and far more possible. So how do we know if we have enough of these nitrates present in our bodies? How do we know when our patient has an optimal versus a suboptimal level of nitric oxide? Well, luckily there is a test for that. And the test for that is the use of very simple nitric oxide test strips. We're not actually testing for nitric oxide here. What we're testing for is the ability to convert nitrate to nitrite, because these nitrites are going to be rolling through the bloodstream and easily and very quickly converted into nitric oxide. Now, nitric oxide actually only remains present in its nitric oxide form for about 3 seconds. So it's a very quick, very rapid transformation from nitrite into nitric oxide and converted back into nitrite after it's been utilized. And so we can't test specifically for nitric oxide, but what we can test for is those nitrites and the ability for the oral microbiome to help shift those nitrates into its healthy, optimal form of nitric oxide. So these test strips are very simple. You place the test strip that says saliva side here on the strip on the tongue for just 5 seconds. You fold the strip onto the other side, press the two ends together. There's 2 pads on these test strips, and you compare the results on the scale below or on the strip tube, which should have an image of it. And so this area below will show us then, are we low or are we on the target or high side in terms of that nitric oxide or nitrite level specifically. And then what we can do is use either dietary or supplemental forms to help support nitric oxide levels within the body. Now, for fun, I waited to take my Foundation's my nitrate support, nitric oxide support supplements earlier today, and I will show you my test strips later. This was my my lower level, which I have right here, if you can see my image on the side, a little bit on the low side to begin with. And I took my capsules right before I started speaking, actually about 20 minutes before I started speaking. And when we get to the Q&A section, I will absolutely show you what the after looks like, okay? So what we want is we want to stay outside of this depleted, low, or threshold state, and we don't want to be in this situation for too long. We want to be sitting in that target zone at the minimal. High is generally not a major issue, but it can be a sign of excess inflammation if we're too high. So something to take a look at. We want to be more on that target side, okay? And so how do we help to support our clients, our patients, to be in that target zone more often than not? Luckily, at Berkeley Life, we offer the total nitric oxide solution. So this begins with a full 3-step protocol that begins with testing. And this is where we can utilize the nitric oxide test strips, which I showed you I am using them with my clients as well. And I love that they can see and have some tangible evidence as to the fact that they're either in need or that something is working. And then we start using the build stage, which is step 1 of the protocol, followed by a balance stage, and then a boost, targeted nutrient intake support as our 3rd step in this protocol. Why don't we go through the protocol briefly so that we all know exactly how we can support our clients overall through this. Number 1, these nitric oxide test strips, which I've spoken about. You'll see that it kind of says saliva here on the one side. So you test by putting the saliva on one side and then pressing the 2 sides together. You then will get the specific color showing up on the opposite side of the saliva here side, okay? Then once we test, we can start working on repletion when these numbers often end up low. And as we often are working with clients that are either dealing with some sort of health struggle, some sort of chronic condition, or that are dealing with age issues, more often than not, I promise you, these numbers tend to be on the low side. We tend to see those test strips show up with a very light pink or sometimes nothing at all, which is a bit of a concern. And so this nitric oxide repletion stage comes in very handy. And step 1 of this system, of this 3-step protocol, is to build. So number 1, as we always want to, we want to start with diet. We want to start with an increased consumption of these nitrate-rich foods. What are some of these foods? We talked a little bit about them, but the most nitrate-rich foods in our wonderful whole foods system include arugula, beets, bok choy, celery, Chinese cabbage, fennel, kale, parsley, radish, spinach, Swiss chard, and turnips. This is all well and good, and I absolutely love starting with diet when I'm working with my clients. I want them to include a lot of these in there. My family is a big fan of arugula, particularly myself and my wife. My kids are a little less so, but I love when I'm able to get some beets and some Chinese cabbage into my diet as well. And these are great as major whole food sources of these nitrates. Not everybody is capable of getting these into their diet on a regular basis. And this is where supplementation can come in very handy. And we want to make sure that we have a high quality nitric oxide support supplement, because it does actually require between 300 and 400 milligrams of nitrate in order to actually see changes occur in the blood pressure and in exercise capacity. And I mentioned that this is an area that I personally am seeing some changes. So since I began utilizing this, very specifically this nitric oxide foundation supplement, I have noticed a major improvement in my exercise capacity, my weightlifting training capacity, and my recovery following my workouts. I tend to recover far more quickly, and I have great energy lasting throughout the day. I'm not getting depleted through the day, even though I have 2 young children that take the life out of me sometimes. We also have a very important thing to note here, that it is going to take about 2 capsules daily to get to that 300 to 400 milligrams of nitrate. As you can see, the proprietary blend present in the foundation's supplement is about 500 milligrams of potassium nitrate, beetroot extract, and organic fermented beetroot powder. So we're getting close to that number that allows us to see changes in blood pressure over time. So this is really important to note. Okay. As well, on the build side of things, we really want to look at lifestyle. This is a really important area that we often, sadly, is overlooked. And one of the big ones here, physical activity, is major. Exercise is a major, major piece. We all know that if we were to take exercise, put it into a pill, and send it out to the rest of the world, it would be the most effective supplement or medication known to man. So adding in good exercise and good lifestyle practices of physical activity is very important in maintaining that build piece on the lifestyle side of things. One of the areas that's very important to look at is how our patients are breathing. And I'm very quickly going to dig into this. There's some pretty intense, wonderful research showing that when we breathe through our mouth, if we are oral or mouth breathers, what that leads to is the reduction of the presence of saliva in our mouth. So people that wake up with a very dry mouth, people that tend to be mouth breathers often require water in order to make sure that they're getting the coating of saliva in their mouth, or the feeling of saliva, but the saliva has actually been dried out. And those nitrites that we know are the storage form of nitric oxide prior to the conversion, the reduction into the nitric oxide stage, when we breathe through our mouth, we're getting rid of a lot of that saliva. And that saliva, if we're lacking saliva overall, then we're lacking the storage capacity for nitrites. And so this is where a lot of these patients will have challenges. When we breathe through our nose, and this is important not only on the nitric oxide side, but very much on the vagus nerve side as well. Breathing through the nose allows for humidification, filtration, and resonation of the air as it enters the body. It actually humidifies it, warms it, and gets it into the lungs ready to be utilized. And that filtration that occurs through our nose hairs allows for particulate matter to be stopped as well. And the research that we're seeing is that nasal breathing, as well as humming or phonation with a nasal sound to it, actually shows an increase in the presence of nitric oxide as well. So utilizing nose breathing or even humming with the nasal phonation is a really wonderful tool in helping to boost nitric oxide levels naturally and maintain the saliva in the mouth and the oral microbiome, so that the oral microbiome can reduce nitrites into nitric oxide very effectively. And when this is working effectively, especially at night when we're sleeping, we're getting that recovery process occurring. Recovery occurs during the nighttime. Recovery is key to handling the stressors that we went through during the day. And most of us, as we know, are not getting great sleep. Our clients are lacking not only time asleep, but quality of sleep. And a lot of them are breathing through their mouth through the night. So tools like mouth taping overnight are really great in helping to support that nasal breathing piece as well overnight. Stress management, this is everything included within vagus nerve work, all the work that I do with my clients that I focus on. And so this is a great tool to add on to, obviously, when you're working with your clients, you want to support their blood flow to support that recovery and manage stress. When they have good working endothelium, you're going to be able to get nutrients where they want to go more effectively, and stress management is going to allow for that resilience to take place. Obviously, smoking and vaping are major stressors, and so cessation of this activity is going to be very helpful in recovery and getting over this challenge. And a big one here is oral hygiene. We'll get into that a little bit more below, okay? Step 2 of the protocol is down to balance. And balance is an important area to look at because we don't want to simply become reliant on the tools here all the time. We want to try to provide the body an opportunity to recover and to maintain its capacity long term. And that's where the balance piece comes into play. So the test strip is great to test again after nitrate consumption, because if we test again, what we then are able to do is indicate how quickly or how much of the nitrite is present, the ability to convert nitrates to nitrite. And oral health plays a huge role here. Okay. If the oral microbiome is out of balance, it's dysbiotic, then nitrite will not show up on the test strip. So we're testing for that nitrite levels. And historically, we've not had a product to help revive that oral microbiome to solve the conversion problem from nitrate to nitrite, and to have that. So a low level plus the use of the beetroot and potassium nitrate, and the nitric oxide foundation supplement will often result in target, or it may not always. And so the conversion here occurs because of the oral microbiome. If that does not occur here, if we're not able to get to that target level with simply the foundation tool, then the oral microbiome needs to be supported. And this is where we can add in prebiotic nitrates and prebiotic nitrate support. This is meant to help support the oral microbiome and the conversion of nitrates into nitrite. This shifts our oral microbiome away from acid-promoting microbes and feeds the nitric oxide supporting microbes, those that convert nitrate into nitrite, to help balance pH and restore microbiome balance overall within the oral microbiome. When it comes down to that oral hygiene piece, some of the most important things that we can do are here below. One of the biggest ones that I see is the use of antiseptic mouthwash. If your clients are using antiseptic mouthwash, they will often have the loss of not only the bacteria that are causing halitosis or any of the oral hygiene challenges that they're dealing with, but often they're killing off the good microbiome. The oral microbiome is part of our gut microbiome. The mouth is the first part of the gut. And so when we try to kill off everything here using a mouthwash, we're actually killing off the good guys as well. So this is the number one. Antiseptic mouthwash is the number one thing for our clients to stop using to help to allow for the conversion of nitrate into nitrite. We also want to be very careful with fluoride toothpastes because it has a similar effect. And then we know that fluoride is involved in blocking iodine in the body. So we want to be really careful about the use of fluoride toothpastes. Another really important area is to become cautious of overusing antimicrobials, including natural versions, including coconut oil and essential oils, because they can often target the good guys as well, the good microbes that are present. So we want to be really careful. Absolutely. Okay. There are dyes and flavor additives we know in so many different foods, and they can have a major effect on the oral microbiome. And antimicrobial chemicals in personal care products, including parabens, are heavily involved in killing off those good guys as well. So be really cautious and very conscious when working with your clients to understand what they may actually be using that's not allowing the conversion of nitrate into nitrite in the oral microbiome from occurring. What we can also do to help support that oral microbiome is to provide a diet that's high in pre and probiotic rich foods. So things like sauerkraut, kimchi, pickles are even a great source of this. Continue consumption of these nitrate rich foods, but incorporate prebiotic and probiotic rich foods at the same time, including a variety of fermented foods, which help to support this oral microbiome as well. Now, the last stage of this is to boost and to get to the level of high levels of nitrate-nitrite conversion and high levels of nitric oxide present at the target level throughout the rest of our clients' lives, ideally naturally. And the way to do this is to test regularly. I'm a fan of daily testing when people are in more of an acute situation, and more irregular, closer to the weekly testing at home, allowing for adjustment of that nitrate capsule based on where they're at. So if people are starting to hit that target level readily and they're not dealing with significant health struggles, they may not need to be on the supplements as often. And that's kind of a goal, because what that means is they're able to convert and produce that nitric oxide ideally within their bodies naturally, which is wonderful. And we can add certain formulas to help support and replete overall nutrient levels, because once we have this good blood flow, then the nutrients that we want to get to those areas will get to the other areas. So we have this wonderful cognitive support that's a very targeted formula for brain function. And there's other formulas that we have that will help to support getting these nutrients everywhere throughout the body, okay? So let's quickly just take a look again at the diet piece. Continue with that nutrient-rich diet, incorporate nitrate-rich foods. Look very specifically at symptom-specific diet protocols, as you already are, low FODMAP, SIBO-specific food plans, Candida diet, whatever it is, but include many of these nitrate-rich foods into those. And where needed, include the elimination diet and Mediterranean diet. But luckily, a lot of those foods that we talked about that are very high in nitrates can be included on these elimination and Mediterranean diet plans, okay? So that's the 3 steps there. We've got, very clearly, we've got, the 3-step protocol here of build, balance, and boost, okay? So who would benefit from supporting their nitric oxide levels? The answer to this is anyone over the age of 40, as we know that nitric oxide levels tend to reduce as we get over age 40. Anyone with oral hygiene or dental issues, this is a great way to understand why that conversion of nitrate to nitrite is not happening. If they have gut issues, we know the involvement of the gut microbiome. That will often involve the oral microbiome as well. I will absolutely state without a doubt, anybody with a chronic inflammatory disease, they're likely not getting good blood flow to the area where that disease is taking place. And so allowing for that blood flow to improve is a great area to look at. Anyone with hypertension, circulation challenges, cardiovascular issues, metabolic issues, this is a big one. Immune dysregulation. Men and women with sexual dysfunction, we know this is an important one because this is a sign of thriving. So if you lack the ability to thrive, you're often going to see that sexual dysfunction is a major issue. Perimenopause or menopausal women are very often notice huge changes when they start improving their nitrate levels and nitric oxide levels. Fertility challenges can be heavily linked here as well. Athletes, particularly in the recovery piece, making sure that their recovery is solid and strong rather than just simply adequate is important, and that allows them to perform at a higher level, particularly as they age. And then anybody interested in a proactive approach to health, particularly those looking at longevity or anti-aging, this is a great way to help support that long-term. All right. What we can do now is to help our patients feel better, faster, and leverage the healing power of nitric oxide. Management of healthy nitric oxide levels for all patients is necessary to support symptom improvement in the gut and everywhere else in the body and the brain. And we know that this 3-step protocol for testing and supporting nitric oxide allows our patients to feel and function better more quickly, okay? NO makes everything else that you're doing work better. That brings us to pretty much the end of my component of the presentation here, and I'm excited to quickly share my email. If you have any questions, feel free to reach out to me anytime. You can follow me on Instagram as well at Dr. Nawaz Habib. And briefly, it was brought up, but this is my book here, Upgrade Your Vagus Nerve. It came out earlier this year. It's doing absolutely wonderfully. If you're interested in learning more about how the vagus nerve is involved in overall health and how to help improve it, please take a look or share with your clients. I've written it in such a way that it's meant to be easy, not only for us as healthcare practitioners, but also for our clients to read and to understand. And lucky for all of us, Berkeley Life has decided to share a very special code and a very special opportunity for anybody here today. So if you are here and you are interested in looking at Berkeley Life products, I highly recommend grabbing this QR code and going to there and using this code IHS15 for 15% off your order today at Berkeley Life. And that offer is good until the 26th of July. All right. And that new Daily Foundations kit covers essentially everything you need to do to get your clients started, including the test strips and the foundation product, which for me are my absolute favorites. Okay. So I hope this has been eye-opening and helpful, and I'm excited to share this with all of you, and thank you for your time and for listening, and I'm excited to get into a Q&A now.
Awesome. Thank you so much, Dr. Habib. It's now time to move into our Q&A session. As a reminder, if you have not already done so, you can ask your questions by submitting them through the Q&A box and hit send to submit your questions. We do already have some great questions here to get started with. Our first question here: would this help with Raynaud's syndrome? Sorry if I pronounced that wrong.
No problem. I'm assuming you meant Raynaud's phenomenon or Raynaud's syndrome. And yes, I absolutely have seen some positive benefits for a couple of my clients that do suffer from Raynaud's. We know that Raynaud's is heavily involved with a circulation issue, a lack of blood flow, particularly to those distal capillaries. And so a lack of nitric oxide will be involved in not allowing that vasodilation to occur. So nitric oxide support can often be there. I would also highly recommend looking into that oral microbiome piece, because often there is an autoimmune component to this as well, a gut issue that is involved. But if we can support that blood vessel optimization right away, we can often get improved symptoms pretty quickly.
Great. Our next question here, do postbiotics help convert traits to trites?
Postbiotics are supportive of the oral microbiome that helps to convert the nitrates to the nitrites. Yes, exactly. So the oral microbiome is very important here. We need to know that there are certain strains that need to be at a high level, certain bacterial strains that need to be at a higher level. And the support for the pre and postbiotics of these oral microbiome factors helps to improve that population. It helps to improve the balance of that population. It's a secondary thing that it would allow for then the nitrate to be converted to nitrite more effectively. But that's where the test strips come in very handy to understand, is the oral microbiome capable of doing this? And then the utilization of the pre and post test strips will help to very clearly tell us about this. And I don't know if we can shift to my picture very quickly to my camera on the screen. Jovi, I don't know if you can do that.
The audience can see your camera.
Okay, you can see me. So this was, I mentioned my pre-test strip, and you'll see that it's kind of a light pink. I did this just before, and just while I was listening to the question about Raynaud's phenomenon, I did a post-test strip, and you can see the difference is very, very profound here. I took the foundation supplement just about an hour and a half ago, and we've hit a target value here. So this is the pre and post. So it's telling me when I test like this, what it's clearly telling me is that I had the oral microbiome factors present, but what I lacked was the nitrate level. And when I supplemented with the nitrate, the oral microbiome was capable of then converting the nitrate into nitrite. And so now I hit that target level. If I don't get to this target level after taking the foundation supplement, then I know that the oral microbiome is more involved and needs to be supported. And that's where the pre and postbiotics and the gum can be utilized very effectively.
Another question here. Can you tell us more about the possible role of nitric oxide in dealing with Crohn's disease?
Yeah, it's a really great question. So on the Crohn's disease side, we're looking at an autoimmune inflammatory reaction in the large intestine. We know that where on inflammation, it's really important to look, okay? So we have to look at white blood cells and how they utilize nitric oxide. And these white blood cells, in particular, the macrophages that are involved here, when there is an inflammatory reaction occurring, we're not using eNOS at that time very effectively. We are using an enzyme that's present particularly in immune cells called iNOS, which is inducible nitric oxide synthase. That uses that same pathway. I'll go back to this, this slide here. We'll go back here. So eNOS is only one of 3 nitric oxide synthase enzymes, okay? Nitric oxide synthase, we've got, like I said, eNOS. There's also neuronal nitric oxide synthase, and there's iNOS, which is inducible nitric oxide synthase. So eNOS is in the blood vessels, nNOS is in the neurons, and iNOS is in the immune cells. And those immune cells, when iNOS is activated, it produces nitric oxide at significant levels, way higher than the target values that we're trying to hit here with general nitric oxide production. That's important because 70% of the immune cells by volume we know are located in the gut lining. And when iNOS is heavily active, it's going to be resulting in this autoimmune reaction that's occurring in the gut in Crohn's disease, in ulcerative colitis, in even general, if we see a high calprotectin level on a stool test, that's going to be involved as well. We have this inflammatory reaction occurring. And often because those immune cells are present in the gut lining, we're not able to shunt that nitric oxide away from that area. So localized, it becomes very, very strong, and it allows for breakdown of the gut lining to occur, resulting in the diagnosis of Crohn's disease. When blood flow is restored through that eNOS activation pathway or through the nitrate pathway, which we now know is the solution when eNOS is no longer active or dysfunctional, when we get to this nitrate pathway, we're actually able to shunt away a lot of that inflammatory reaction that's occurring and get rid of some of those challenges. There is also importance in looking at vagus nerve function. There's importance, obviously, at looking at the gut microbiome and supporting the gut microbiome through probiotics, prebiotics, but ensuring that it's a very targeted approach. This is a great supplemental tool to that. It's not going to have a very targeted effect on the gut itself, but throughout the entirety of the body, it's going to allow for circulation to just get much better.
Another question here. What is the half-life of the supplement? So how long does it keep the nitrates at high levels for hours, days, etc.?
Yeah, so it depends on the person, right? Because the half-life itself is less of a concern when somebody has good conversion capacity and they're younger and there's very specific factors involved here, because we can often, through dietary sources and through other challenges, improve the presence of nitrates naturally. The supplement itself tends to last for about 18 to 24 hours in most cases. So we'll often see a need early on for daily supplementation, often not more than that. So 2 capsules daily tends to be more than significant, more than enough. That 300 to 400 milligrams threshold needs to be reached on a daily basis, but we'll see those values remain high for the 18 to 24 hour period. And then we'll often see over time, as people get into that 2 or 3 months of being on the supplement, that they no longer are in that low threshold to begin with. And so they'll often be able to come off of higher doses of the supplement, maybe bring the dosage down as time goes on. And ideally, in an eventual and ideal situation, They can even just utilize it on an as needed basis because they've repleted these levels naturally through microbiome support and dietary support.
Awesome. Thank you for that. Another question here. What are your thoughts on the use of dietary nitrates when a patient is also taking a PDE5 inhibitor? Could it provide greater efficacy of ED medications due to improved vagus nerve regulation?
It's certainly possible. So I've not seen it clinically in my practice. It's difficult for me to jump on it, but theoretically there is an absolute link to this because we know that the neuronal regulator of the entire body, the autonomic regulator linchpin piece, is that vagus nerve piece. And if we don't have effective vagus nerve signaling, then we saw obviously the chat cells are not able to be activated. We have higher blood pressure. We have less signaling of acetylcholine converting or allowing for the nitric oxide production as well. It is a secondary piece. I feel like the combination of the two will result in long-term support. So in theory, yes, absolutely. In practice, I can't speak to it, unfortunately.
Awesome. We have another question here. How often do you check nitric oxide levels?
Personally, I test them daily. With my clients that I'm starting out, it's a daily test as well. I'll often just check to see if I'm low or at threshold and take my supplements accordingly. I will take my supplements regardless on days when I do weight training to help with my recovery. So that is an important piece to that puzzle personally. But for most people, I'm having them test and determine from there. I love the test, don't guess method, and the test strips allow for that to become much more doable and ideal.
Thank you for that. Another question here. How can you prioritize nitric oxide systems with other supplements, protocols, and/or treatment plans?
I think the best way to think about this is if we are not getting the results that we're looking for right off the bat, or within a couple of months, let's say we've started a protocol and our clients are still not able to handle things, that the inflammation levels are still high, their symptoms are still pretty problematic. This is a great way to kind of take a step back, test to see what's going on with their nitric oxide test strips, see what's going on with their oral microbiome, maybe just do a bit of a reset plan, and maybe try a foundations protocol for a couple of months to see if there is a positive effect if we see on the test strips that they're low. It can be a great way to do a bit of a reset when we hit a plateau as well, because that plateau may be occurring because we haven't gotten effective vasodilation and eNOS activation, or specifically the nitric oxide levels just aren't at a high enough level for the nutrients to get where we want to go. So I would love to include this. In my personal case, I'm using it very proactively, but with my clients, I use it whenever I hit a plateau. It's kind of a good tool to think of in that situation based on test strips. So it's not like, oh my God, we hit a plateau, let's throw in the foundations. I will definitely test first to help determine if the foundations would be a good fit for them.
Thank you for that response. We just got another question here. Do the supplements or nitric oxide interact with ashwagandha and/or turmeric?
Don't think they're going to react specifically with ashwagandha or turmeric. I'd have to do a little bit more research on that one, and if you're okay, I'd be happy to get back to you on that one afterwards. I don't know off the top of my head. I will do some research though.
Perfect, thank you. Can you elaborate on how optimized blood flow through nitric oxide contributes to various aspects of health? And are there specific studies or clinical examples that highlight these benefits?
Yeah, there are a lot of studies on nitric oxide being involved in optimal function, cognition, inflammation control, even in obviously like sexual function and the ability for our bodies to thrive. There's a ton of research out there. PubMed is absolutely stacked, thousands and thousands of research studies on this. Um, I think the presentation kind of covered most of that. I would love to say that when there is some sort of inflammatory reaction occurring, we're often unable to optimally get nutrients in and toxins out. And that is a sign that the transport mechanism, which is the blood vessels, are dysfunctional. They're just either dysfunctional in terms of narrowness, in terms of thickening, or a lack of resilience. And they're just not capable of becoming relaxed enough to allow for the blood to flow through effectively. And so, what I want to do is, through this nitric oxide pathway, through the production of these nitric oxide levels, allow for the blood vessels to become more resilient, to allow for that blood flow to optimize. And that will allow for nutrients to get where they need to get and for toxins to get out. And we know that that piece is often missed. And so you can think of it this way: whenever there's a strike by the waste management people, the garbage, the recycling, and the compost, the buildup of toxins was going to be pretty significant. We're obviously, like, the smells and the sounds and just how everybody's feeling when the toxin level's high is not going to be good. In the internal environment, at a cellular level, the same thing happens. There are a lot of cellular waste products that need to be eliminated from the site of those cells. These are oxidative stressors, reactive oxygen species, just mechanisms by which the cells need to get rid of toxins. And when we can't get them out, we can't shut them out, what that does is it builds up in the cells and it results in a higher inflammatory reactive capacity, or a link to more inflammation. So by increasing blood vessel resilience, by increasing vasodilation, we're reopening and allowing for more in and more out. And that allows for the toxins to be released really effectively. So I think that will result in optimal function and optimal performance, or at least better than where we're at, when the blood vessels are capable of passing nutrients in and toxins out more effectively.
I think we have time for one more question. But can you tell us, if someone is using the gum, can they still get the benefits without swallowing, instead just holding it in their mouth?
I think there are a lot of benefits that can come from simply chewing the gum. I don't think it needs to be something that's swallowed, because the effect is intended for the oral microbiome. And for people that may be sensitive to some of the other ingredients in the gum, you may often notice that you're not getting, you're maybe a little bit more hesitant to use that. I think the utilization of the gum is meant to be orally to begin with, and then we can absolutely spit it out afterwards. I don't see any reason why you would have to swallow it.
Awesome. Well, it looks like that's all the time we have for today's program. If you were not able to ask your question, or if you have any additional questions, you can email them to info@naturalmedicinejournal.com. I do just have a few quick housekeeping notes to go over before we officially close out. If you could please fill out the short evaluation form that will appear when you close the webinar. This will better help us serve your needs in future webinars. And as a reminder, the on-demand materials will be emailed to everyone within 2 business days. This will include a PDF of the slides as well as a link to the recording of today's presentation. And thank you again to Dr. Habib for a great presentation today. And thank you to all of our attendees for taking the time out of your busy days to join us. This webinar was brought to you by Natural Medicine Journal and sponsored by Berkeley Life. Thank you all and have a great day.